Screening for depression in African Americans, overlooking unspoken signs. My name is Chantre Moore. I attend the University of Texas at Rio Grande Valley. I am a psych mental health nurse practitioner postmaster's student. These are a few quick facts in regards to African Americans with depression and mental illness. African Americans account for roughly 13.2% of the general United States population. Out of the 13.2%, there are 20% who are more prone to being diagnosed with a mental illness. This is 6.8 million people. Only 25% of African Americans explore mental health assistance as compared to the 40% of Caucasians that seek help. African American teens are less likely to commit suicide in comparison to white Americans. Mental illness in the African American community can be considered punitive measures. African Americans statistically will see more violence and crime, which in turn increases their susceptibility to mental illness. Depression. It falls under the category of a mood disorder, adversely affecting a person's feelings, mood, and how they act. Depression can interfere with a person's activity of daily living. Some of the signs and symptoms of depression: a person may appear persistently sad, anxious, or feeling empty, feelings of hopelessness, irritability. They may have feelings of guilt, worthlessness, or hopelessness and helplessness, loss of interest or pleasure in hobbies and activities that they once found pleasurable. They may have decreased energy and fatigue, moving or talking more slowly, also feeling restless or having trouble sitting still. People with depression may find it difficulty concentrating, difficulty remembering, or even making decisions. Also, difficulty sleeping, difficulty early morning awakening, or even oversleeping, changes in appetite and or weight, either gain or loss, thoughts of death or suicide, or even they may have tried suicide attempts. They may also have aches or pains, headaches, cramps, digestive problems without a clear physical cause, and or that do not ease even with treatment in regards to the stomach aches. Recent studies. Studies showed that African American men signs and symptoms of depression were far different than any other race. Often, their depression is exhibited through, but not limited to, increased hostility, drug use, the inability to focus, memory problems, decreased interest in sex as well. This study shows how some attributes, such as a Black woman's attitudes, behaviors, and mental health challenges, are molded by their race and gender. Studies also reveal that clinicians are not culturally competent in recognizing signs and symptoms of depression in African Americans. African American women find strength during their difficult times in the face of all the adversity that stacked against her. African American college students who attended historically Black colleges or universities rather than a primarily white institution had a higher rate of success. In African American women who experienced postpartum depression, they felt there was no education given and proper resources during their pregnancy in regards to postpartum depression. Most African Americans related and confided more in clinicians who were similar to them, meaning that they were African American as well, as opposed to those who were Caucasians. The issue was not there enough of African American providers as far as relating to them being able to confide in or feeling comfortable in. Recommendations. According to the Center for Discovering and Transforming Lives, and I quote, additionally, there needs to be an increase in the number of African American mental health professionals and a greater culturally competency in those currently in the field, as well as an increase in education in the faith communities about the role of professional mental health treatments and how they can work together. I close quote. Also, a recommendation was to help eradicate the negative stigma that's associated with mental health and seeking mental health treatment. Possibly put mental health education in high schools and colleges as a required course. This will provide education to the younger generation to be able to recognize signs and symptoms, not only in others, but in themselves as well, if applicable. Lastly, one of the recommendations in predominantly African American communities, setting up health fairs at local churches, clubs, and other places frequented by African Americans. The goal is to meet them where they are. I thank you for listening to my presentation. The next couple slides are my references. Thank you again.